Apparently, one of the patients took his tray and proceeded to beat another patient around the face with it.
I was in the dining room and he just starts wailing on me with his tray. The guy's crazy.
I'm being ripped off by bin Laden, a little bit at a time. I'm with the CIA, and bin Laden, he gives me my allowance, and lately it hasn't been the full amount. It's been less and less.
I didn't do anything. I didn't do anything wrong.
The victim is a low-functioning female and nonverbal.
She's a little bit nervous, but I've reassured her that she hasn't done anything wrong, and you're here to help her.
How do you know John is your boyfriend?
He kissed me.
John is the staff member that helps Diana with her daily routine.
Toss the ball, catch the ball.
Welfare and Institution Code 4427.5 has always required facility law enforcement to report certain incidents to outside law enforcement. With Assembly Bill 602's passing in 2014, it changed Welfare and Institution Code 4427.5 to mandate that we report those specific incidents within a certain time period, and that outside law enforcement respond and consult with facility police regarding certain types of serious investigations.
The reasons for AB 602 is that too many crimes occurring within the system for those with disabilities were going uninvestigated, unreported, unresolved. That led to problems and lack of justice for the victims.
I believe this training video is going to help assist local police forces for these centers and for these state hospitals work cooperatively with local law enforcement, because they're going to have a better understanding of what exactly does a hospital police department or a developmental center police department do. What do they respond to? What are we obligated to do under law? And what is expected of them as well, the local law enforcement agencies, because they are going to have an increased call for service, and they're going to wonder why. You know, why are we responding to these facilities or these centers when they have their own police force?
The expectation of the mandate is to have checks and balances in place to ensure that not only are we responding to allegations of abuse and neglect against patients and clients, but that outside law enforcement comes in when those cases are alleged, and they have to come in to at least, at a minimum, communicate with our internal law enforcement to ensure that there's a proper response and a thorough investigation conducted, and regardless of who's going to take jurisdiction over the investigation.
First off, it's important to understand that the patients in the state hospital, there's nobody that's there voluntarily. A court has placed the patient in the state hospital.
Something happens on the unit, the police officers arrive, and the first thing they want to know from the doctor or from a nurse is a question about capacity. I'd like to interview this patient. Does this person understand what they're asked? And how well can they communicate that experience back to me? Once they get dangerousness issues out of the way, that's usually the issue that they ask.
When doing these types of investigations, it can be challenging at times due to the fact that there may be communication barriers or intellectual or physical disabilities that may not allow these clients or patients to fully participate.
I mean, people that are experiencing mental health issues are often victims of crime because the perpetrator knows no one's going to believe them.
It's a new environment for them. Normally, local law enforcement, their contacts or their investigations are out in the community, and now they're in a different culture. At times, it's a locked facility, and those investigations will be similar to what they do in the community, but their contacts with either suspects or victims or witnesses is a little bit different because that environment's different.
One of the key areas I think that law enforcement could really work with is when you see these individuals, remember that they will probably respond to you if you give them the right message. And the right message is, I'm going to help you.
Investigating crimes within a state mental health facility or a developmental center has its challenges. Not only is it a unique environment, but the victims and suspects that you will encounter are equally challenging, which makes investigating crimes committed there different from what you may be used to. In this program, we will look at the many challenges when investigating crimes that are committed within this environment. Hello, I'm Mark Bailey, and I'll be your host. Throughout the state of California, there are several facilities that house those who have severe mental health illnesses or who have developmental or intellectual disabilities. There are a variety of laws under both the Penal Code and the Welfare and Institutions Code that can lead to the commitment of an individual. Some reasons for which one can be committed into a state facility and require that they remain there may be because they cannot provide their own food, shelter, or clothing. They don't integrate well into the community, or they have no family to take care of them. Some are there because they have committed a crime and are undergoing treatment until they can be deemed competent to stand trial. In all cases, patients living in either state mental health institutions or developmental centers have been committed to the facility via a court order. Let's take a minute to see where mental hospitals and developmental centers are located throughout our state. Keep in mind that as budgets and funding change, these locations may change. There are 5 standalone mental institutions and 3 psychiatric programs within prisons that are run by the Department of State Hospitals, also known as DHS. They currently treat approximately 6,500 to 7,000 patients. These are all locked facilities, and most patients are under treatment that require medications. This can make interviewing difficult when investigating a crime. There is also the population of patients with developmental disabilities who are cared for by DDS, or the Department of Developmental Services. There are 4 state-run facilities in this category. Currently, DDS serves more than 1,200 patients. The goal of this program is to educate law enforcement on what defines a person with a mental illness versus a person with a developmental disability and the facilities in which they reside, who could possibly be a perpetrator, and the possible crimes that can be committed within a facility, barriers that you might encounter when investigating a crime, tips on how to conduct an investigation within this challenging environment, interview techniques and de-escalation tips when you have a patient who is agitated, and lastly, some final thoughts from our subject matter experts.
Welfare and Institutions Code, Section 4427.5, is the enactment of AB 602. And what it does is it codifies and specifies what has to be done when a serious offense is committed on the grounds or inside of a facility for those with developmental disabilities. It really basically says if there's a serious offense that is alleged, not proven, but alleged, it needs to be fully investigated, not just by the facility itself, but that needs to be reported to local law enforcement to do a complete law enforcement investigation.
Protecting the rights of victims within mental health and developmental centers requires checks and balances. State-run facilities have their own internal law enforcement that investigates crime daily. But what constitutes a major crime that is so severe that internal law enforcement must request the support of local law enforcement? AB 602 now defines that and provides protection to victims of serious crimes that are committed within a state facility.
Good afternoon, everyone. Today, in a few seconds, we're going to have Lieutenant Richards come up and talk with us. He's our liaison with developmental services and state hospitals. Lieutenant Richards.
Sergeant Douglas, thank you. Gentlemen, good afternoon. Good afternoon. How you doing? Yeah, I know you're all anxious to get out there and get working, but we're going to take a few minutes of your time. In my job, I'm the liaison with the centers and the state hospitals, and so I've learned a little bit more about what they do and how they do it. And so that's why I'm here today, to make sure that you're aware of it and what our responsibility is when we respond. At the beginning of the year, there was an update to Welfare and Institutions Code 4427.5. Okay, and in this update, it puts mandates on the developmental centers to report 6 different things to the local law enforcement agency that's closest to that facility. There's facilities all over the state. So those 6 things that they are mandated to report to us are the death of a resident, an assault with a deadly weapon, assault that is likely to produce great bodily injury, a sexual assault of a resident, also if there is a broken bone of a resident of an unknown cause, or any injury to the genitals of a resident where the cause is undetermined. The way that it's really geared now, and the way they want us to respond, is that in these serious conditions, if we go out and talk to the local law enforcement at the facility, we're going to meet with them, and then based on the nature of the call, then we decide whether or not it's going to be a report, whether or not we need to call out our agency's detectives to do further investigation. Within the state, we have several mental institutions, such as state hospitals, and that's where they have a bunch of patients that have mental illnesses. We also have developmental centers. Currently, we have 4, and then we also have community facilities, which also work with those individuals with developmental disabilities. Let's talk about the state hospitals. Okay, these are secure facilities. They have locked housing units. The facility that's closest to us has more than 600 patients there. These are individuals who have been committed by the court, so the court's ordered them to be there. The developmental centers are open campuses, so they might have some areas that are locked within it, but they have a variety of people there. Some of them need complete care 24 hours a day. When you're looking at how you're going to investigate, take a few minutes, talk with the staff, and find out what it is about that particular individual. They'll be able to provide you all kinds of information, because the majority of the people at developmental centers have been there for many years, and some their entire lives from the time that they were a young child. It's my job as a liaison with the state hospitals and the developmental centers is that we are developing basically this relationship with them to make sure that when our response, we're going to cooperate, we're going to communicate, and we're going to be able to really assist them the best that we can based on especially our resources, and this new law really mandates this cooperation. Okay, thank you for your time. Let's go hit the beat. Have a great day. Be safe.
Thank you. Thanks, sir.
What this video did was it hit a couple of points, but the 2 majors I want to talk to you guys about is, 1, it gave a quick hitting tutorial on mental health challenges and what you might be facing when you respond to locations. And 2, and the most important for our purposes here today, is that the laws have changed and we are going to be responding to these places more frequently. We've got state hospitals and the residential facilities in our jurisdiction, so it's important that we understand all of the nuances and some of the things that he discussed in the video with regard to our response. Okay, it's important to understand that there's going to be many different types of patients based on the type of facility we go to. So let's talk a little bit about that. Why is it important to understand which type of facility and how might that impact your approach?
Well, like they mentioned, the state hospitals have their own police force. You're going to be dealing with, much higher level of security, higher level of clientele in the state hospital versus the residential facilities.
Very important, extremely important. And what does that mean to us in terms of safety, for instance?
The higher risk offenders are going to be in the state hospitals versus the residential facilities.
All right, so there's the nuance of how we approach it. There's also the issues of what we're going to be faced with once we get there. What are some of the things we can do to get ahead of the game? What are some of the things we can do to make sure that when we respond to these locations, that we are prepared and ready to handle scenarios that might arise based on the changes in the frequency with which we're going to be going out to these places?
It goes back to whether it's getting to know people who work in those residential areas, just building a rapport with them already, knowing the call history there, have we responded earlier and what have we responded for.
And it's really important to get ahead of the game in regard to the changes of the law, and specifically the components of 4427.5, the Welfare Institutions Code. It's really important to get ahead of that. So make sure that you guys are doing that and passing that on to the folks that relieve you, that those are going to be things that we're going to deal with as we respond to these locations. Okay. Any questions from you guys?
Well, if an institution has their own law enforcement, why would we respond to a radio call?
Well, remember that the changes in the law with the Welfare Institutions Code require them to make contact with us and have us respond. Whether or not we take, an investigation or the direction the investigation takes, is contingent upon what we find. But they have to call us and we have to respond. Any other questions?
Yes, Sarge, I've never been out to this place before, but are we allowed to take our firearms in there?
Well, there's a couple things. One, we probably need to get out there ahead of time so we have the answers to these questions, given the number of facilities we have. But I would look at it as if you were going to a regular jail facility. Be expecting that at some point you may need to secure your firearm. But the facilities are all different. Some of them have a campus area that you can respond into armed, and then they have a secure area where you may be going into where you have to secure your firearm. Some of them may be secure from the front gate. So take that into consideration, be aware of it, and don't be surprised by it. Okay. Be aware that we have numerous types of facilities within our jurisdiction. There's state facilities, there's residential group homes, there's vocational facilities, and there's developmental facilities. So they all have a different nuance to them, different types of patients, different protocols, different rules. So let's get familiar with them ahead of time, and it'll certainly, solve some of our problems going in. All right, man, let's get out there and let's do it. Be aware we're going to be responding out to these places, and let's apply the stuff that we're learning out there, okay? Be safe.
Mental illness, simply put, is a medical disorder. Symptoms of mood disturbance, severe depression or bipolar disorder, mania, they severely limit a person's ability to interact with others, oftentimes to differentiate between what's real and what's not real.
Developmental disabilities is an intellectual disability, and that would be somebody who has a significant sub-average intellectual functioning, and we measure that at IQ of 70 or below.
These are conditions that typically affect a person early in life. They're chronic, which means that they will last the person's entire life, and also impede their ability to be successful in major areas of life, like in relationships, work, school. Some very common developmental disabilities that law enforcement officers might encounter in the community would include disorders like Down syndrome, Rett disorder, cerebral palsy.
One thing that I think is really important to understand is that sometimes with an intellectual disability, they could also have a mental disorder. So it would be a co-occurring disorder. So you might have somebody with an intellectual disability who also has a diagnosis of schizophrenia or bipolar disorder.
Individuals placed within the state hospital system as opposed to those placed within the developmental center system differ in that those that are assigned to state hospital facilities are diagnosed with mental health disorders. So they need psychiatric services, they require medications to stabilize them and to assist with a variety of disorders. Individuals with developmental disabilities don't necessarily need psychiatric medications. They need more behavioral therapy, support, and assistance with daily living functions such as hygiene, feeding, vocational skills.
Okay, a state hospital is a secure facility. You have civilly committed patients, which means that they've been committed there because they're a danger to themselves or others. They don't have a criminal component to their commitment. They're essentially unable to take care of themselves, and they could potentially hurt themselves or somebody else. But we also have forensic patients, and forensic patients typically means they have committed a crime, and the courts have committed them forensically to the state hospital. So they are locked up in a secure environment within the state hospital.
Because there's so many avenues to get into the developmental system. You could be conserved by a family member of the community. You could be conserved by the court. You could commit a crime, and while that's pending, you don't understand what's going on in court. So you're not really conserved, but they're still going to send you to one of those facilities for observation and treatment until you can understand what's going on.
State hospital can sort of be thought of as sort of when everything else has failed, the patients end up in state hospital. So they have kind of worked their way up the ladder.
People with mental illnesses or who have a developmental disability are not restricted to living within state hospitals. There are also group homes and other community-based residential sites where they reside within the community.
We have an obligation to notify them. They have an obligation to respond. But once they respond to the hospital, they will review and evaluate the situation to determine if it's warranted for them to further the investigation or hand the case back to the local law enforcement jurisdiction within the state hospital.
Now you know more about the people who live in state facilities and their types of disabilities. In the next segment, we will take a closer look at the perpetrators who can be found within a facility and what types of crimes can be committed.
You have patient-on-patient crimes. You have caregiver crimes. You might have people that are visitors to the house that commit the crimes. So you have to keep an open mind as to who your suspects may be. You can't just assume every time that it's the person that's suffering with mental illness. They're more likely to be a victim of crime than actually be the suspects.
Almost any type of crime that can be committed can occur within a facility. Perpetrators can include other patients, staff, or anyone who has contact with the victim. What makes these investigations challenging are issues like determining the functioning level of those involved, and that can vary widely.
Toss the ball, catch the ball. They toss the ball, they catch the ball. They toss the ball, they catch the ball.
Have you seen Cindy and Tommy? I noticed them earlier at lunch. Did they go back to their rooms?
Catch the ball. Toss the ball. You drop the ball.
Michael Crawford, 340. Michael Crawford, please call 340.
What are you doing?
Didn't do anything.
Cindy, are you okay? Cindy, I'm gonna help you put your clothes back on, okay? And help you get back to your room.
I didn't do anything wrong.
Yes. The victim is a low-functioning female and nonverbal. During the incident, she appeared calm and didn't exhibit any signs of distress. The male patient wasn't restraining her in any way, nor did he have a weapon. She didn't respond to any of my staff once we got her to her room, which isn't unusual.
All right, guys, you just got this call. What do you do with it? Do you need anything when you're preparing your response? When you're on your way there, are there things you need to be thinking about?
Well, if she's capable of giving consent, if the nurse stated that she's nonverbal and low functioning, so, one of the elements would be that she's, able to say no or give consent.
All right. Well, what kind of things do you need for the preliminary investigation? When you get there, the first thing you see when you get there is you're talking to the folks that were just in that video. What do you need to gather? What do you need for the preliminary stuff?
Well, we'd first want to talk to the employee that contacted him first, too, and find out what she saw and ask her what the situation was before we would contact the victims as well.
Is it relevant whether or not either the suspect or the potential victim are high functioning or low functioning? Is it relevant to your investigation?
I think it may be, yeah.
In what way? Maybe some examples.
I mean, if they're both low functioning versus one's high and the other one's low, there's a difference there of the mental capabilities, I believe, of them, either being able to consent or knowing the difference between right and wrong, things like that. We don't know what their capabilities are mentally.
Can you expect some challenges in this environment when you get there to conduct your investigation?
Definitely.
What kind of challenges maybe might we expect once we roll into the location, the facility?
Victim is nonverbal, so are we even going to be able to show that it wasn't consensual, or if there was a crime? We don't know if the suspect is high functioning or low functioning, or if he does have that mental capability to know whether what he was doing is right or wrong, even though he kept repeating, I didn't do anything wrong. We don't know what his level is.
What other facilities issues might be present when you get there to conduct your investigation?
Maybe other ways to communicate with the alleged victim as well. Maybe she's not verbal, but there's other ways of communication. Maybe talk with a social worker, see if they have any ideas as far as their communication levels. Help you perhaps interview in a different way.
Dad, who can we go to there? What about our staff resources? Who do we have there? Who do you think we might have there?
A charge nurse or any of the other staff that, routinely, take care of the patients.
Doctors,
deal with
maybe?
them. Doctors,
people who deal with them?
social workers.
Maybe a designated person, some social workers, maybe? Anybody else?
Maybe a psychologist, perhaps.
Might be a good thing, right? Would that be a consideration for us in this case?
Well, actually, it's a team effort. Of course, we can override a doctor's ruling, but essentially a doctor could say, it appears to be forced trauma. There might be some injuries that coincide with more than just a consensual encounter.
In order to get there, we probably have to be in the middle of the SART exam to start figuring out the forced trauma and those kind of things, right?
Right.
So there's some steps we need to take before we get there, right?
But I guess a medical professional could maybe at least give you some advice, what their opinion is.
Yeah, we agree with that, right? Probably have some input from the folks. You don't agree?
I don't think I would do it twice. I wouldn't put a victim through 2 exams like that. So I wouldn't do a first exam for visual just to see if there's enough for a SART and then do another exam. It would just be either do a SART or you don't.
Things we need to take into consideration, right? But including those people while we're making those decisions is pretty important, you think? Okay, would it change if the suspect was a staff member? Would that change the context of your investigation or how you're going to proceed?
Definitely.
In what way?
Because the staff member would be higher level functioning, and they'd have some sort of intent. So their consent would be much more of a issue.
Well, we certainly need to conduct what we consider a normal preliminary investigation, right?
Correct.
We're going to consider evidence, we're going to consider statements, we're going to consider all the things that go into a regular investigation, but clearly this is a challenging environment. So talk about some of the other things. What about the history of the patients? How important is that?
Well, it's very important. I mean, you don't know their background. You don't know if they've been involved in things prior to, or if this is a one-time event, their history with each other, how they interact with other people, not just these 2 people, but how they interact with other males, other females in the facility.
Okay, what about history concerns specific to what the allegations are?
We may want to find out if there's any other previous reports with that same suspect, with any of the other people in that environment. Find out if there's a history of him doing the same thing with someone else, and what the situation or the circumstances were for that situation.
Check for video surveillance. See if there was any force or any coercion trying to get her into the room alone.
Is there anything else?
Just getting the witness statements, contact information.
Witness statements. Witness statements, very important. Are there any witnesses? Are the witnesses, do they have a capacity to provide good statements? Those are things that we need to consider. So make sure we're taking all those things into account.
Going back to clothing real quick, you can also look for any type of damage in the clothing. Is it stretched out of place, ripped, torn? Also, any bruising that might indicate the level of force that might be used
we're
as well.
talking about certainly all the standard investigative techniques.
Correct.
Evidence, statements, video, audio, all the things that go into a very comprehensive preliminary investigation, yes?
Correct.
All right, guys. Well, it's time to hit the beat, so let's get out there, be safe, and that's it.
Thank you.
Within a state hospital, really anybody could be a perpetrator. If we think about the people that we have in the hospital, obviously we have patients, obviously we have staff, nurses, doctors, psychologists, social workers, but we also have the other people that go along with running any kind of institution. We have the janitors, we have the engineers, we have the electricians. We even have visitors that can come to the hospital to be seeing a patient who could be involved in some sort of crime.
These individuals are easily victimized, and the people who victimize them can be sometimes the most trusted individuals. I want the police officer to be aware of that and also recognize that these individuals need your help.
A few cases where the abuser was a bus driver. Residents of the facility would take a bus to a day service location to conduct jobs, and we found that the bus driver was having 1 or more residents at different times stay after on the bus and then abusing them when they got them alone.
When law enforcement comes in to do an investigation at any of the statewide facilities, it's very important for them to understand that the individual assisting them could possibly be the perpetrator of the crime that they're there to investigate. So it's very important to talk with charge nurses, unit supervisors, other law enforcement staff who are familiar with the client, and ensure that their behavior isn't suspicious. If the person's baseline behavior during your interview, if it's unusually withdrawn, if they refuse to participate, if it's very different from how their daily interactions would be, then you might need to be suspicious that the individual in the room with them could be intimidating them, could be threatening them, or the person could have a bonded relationship with that individual, inappropriate as that may be, and trying to protect them.
Knowing that anyone within a facility can be a suspect is important. But in addition to the 6 situations that require mandatory reporting to outside law enforcement, there are other types of crimes that you should keep in mind. Some typical crimes encountered include theft, verbal abuse, physical assault, plus caregivers' crimes such as abandonment, isolation, and even violation of patients' rights. Officers handling crimes involving this population should also review Penal Code 368 and 368.5.
One of the most heinous forms of abuse of someone with a disability is isolation and neglect. It's also a form of imprisonment. You're keeping someone from contact with family, you're keeping them from contact with others, you're keeping them from conducting their day as they want to, whether that's going outside, going to community meals in the cafeteria, and it's a pretty heinous but often overlooked form of abuse. In California, when someone is targeted because of their status of having a disability, it qualifies under one of the subsections of Penal Code Section 422 as a hate crime. What that basically does is allow for increased punishment of that individual for committing crimes that our society is not willing to tolerate.
Higher functioning patients do prey upon lower functioning clients, and that is due to the lower functioning patient may not be aware that they're having their items taken from them, or they may be told that it's only being borrowed, yet the higher functioning patient has the intent of not returning it.
Over the years, we've found that people with developmental disabilities or dependent adults, as they're referred to under the criminal law in California, become easy targets because they're easy targets. They're often viewed as not being good witnesses. They're viewed as not being good historians. They're viewed as being overly emotional. Sometimes there's communication issues, and sometimes they're just readily available.
Remember, just because someone has an injury doesn't mean it was inflicted by someone else.
So if you see a patient with a significant injury, your first thought's going to be, how did that happen? Did somebody do that to the patient? Was that done by the hands of another? So that's where the law enforcement officer and or investigator that's assigned to the case needs to talk to the level of care staff that have direct supervision with the patient, the nursing staff, to ascertain and to review if the patient has self-injurious behaviors. You want to go and review those in the medical records to make a determination, was this injury done as a result of a self-injurious behavior, or was it done by the hands of another?
When questioning a patient, how can you determine their capacity to understand your questions? If they are low functioning, what validity will their statements have?
Because of their mental illness and their inability to, interact with their environment in a successful way, a court has taken away some of their rights and placed them in the care of a conservator. And the conservator has opted to place them in the state hospital.
Capacity is tied directly to a person's intellectual abilities. And in the vignette we saw with Cindy, the question about whether she has the capacity to understand what was happening to her and whether she had the ability to give consent for sex is going to be tied directly to her intellectual functioning.
Anytime you have an allegation of a sexual assault, having a SART exam performed is recommended to aid in your investigation.
Sexual assault examinations are crucial in providing corroborative evidence, but the exam itself doesn't prove that a crime occurred. It may show that intercourse occurred, or it may show that physical abuse occurred. The question then becomes, in the example that was shown, does the victim have the ability to give consent? Is their disability so severe that they cannot give legal consent to the intercourse? The sexual assault exam confirms the act happened. Their lack of ability to give consent confirms that it was illegal.
You may want to consult with the medical physician on duty. However, law enforcement has to take the lead in determining and assessing what evidence you have, the allegations that are involved, the persons involved. If an individual is conserved, you have to ensure that you contact the conservator to provide permission to conduct the SART exam.
A sexual assault exam can assist in the investigation. It can protect not only the victim, but also the suspect at times, because there are occasions where there are false allegations.
Identifying the victim, suspect, and the cognitive ability of each are all important factors when investigating a crime within a facility. But what other challenges can you expect? In this next segment, we will explore some of the unique characteristics and barriers you may encounter when conducting your investigation.
During the course of an interview with a client or patient, there may be some underlying issues that may hinder your investigation as far as the client's IQ level. You may want to contact level of care staff who have a better rapport with this client or patient, who can give you a better understanding of what their intellectual level is, and go from that point. If you need an interpreter, or if you need somebody that does sign language to assist during the course of the interview, those would be things to look into.
In this segment, we will discuss some of the barriers you may encounter when conducting an interview with a victim, suspect, or witnesses within a facility. Some patients may be so low functioning that they are nonverbal or possibly require assisted devices in order to communicate. You may also be faced with situations where the victim or suspect didn't know that they were even involved in a crime. A victim may not know that what has happened to them was wrong, or a suspect may not know that their behavior was a crime or abuse. Lastly, visitors and facility staff are not exempt from misconduct.
Hi, Sherry. Oh, hi, guys. Thanks for coming. One of our female patients with Down syndrome had been complaining of vaginal irritation. We took her to the doctor for a routine medical exam, and we found out that she has chlamydia. The patient's name is Diana. An institutional report has been filed by the nurse who took her to the doctor, but of course it's protocol to also file the police report.
Okay. Is she verbal? Can she answer our questions pretty well?
She has some difficulty communicating. She has a moderate intellectual disability, and it's a little hard to understand her, but she can communicate, so just be patient with her. And she's a little bit nervous, but I've reassured her that she hasn't done anything wrong, and you're here to help her. She's just afraid she's going to get into trouble.
Okay. Is there somewhere private that we can talk to her?
Yeah, I've got her in a group room down the hall.
Okay. Sherry, would you mind just hanging outside the door when we speak with her?
Yeah, I'll stay in the hallway in case you need me.
Okay, cool.
Thanks. Okay. Let's head on down.
This way?
Right this way, yeah.
Okay.
This way.
I like it. Yes.
Thank you, Sherry.
Hi, Diana.
Oh, hi.
Remember we said that some officers would come to talk to you?
Okay.
Here they are. So,
hi, Diana.
I'll let you guys do.
Can I have a seat?
Sure.
So I'm Officer Eden. How are you doing today? Diana, do you know why I might be here today? Diana, can you tell me why I'm here? Did something happen recently that you need to tell the police about? Are you having a hard time understanding what I'm asking you?
Maybe I should get Sherry in here. She can help us.
That's a
Are
good
you
idea.
okay with that, Diana?
Yes.
Hi, what's going on?
We're having a little bit of trouble communicating.
Oh my
Maybe
God,
you can help us.
I should have told you guys. Diana's much more comfortable talking with women. Maybe you could talk to her.
Okay.
Thanks. Diana, why don't I hang out with you guys, okay?
Hi, Diana.
Hi.
How are you today?
I'm fine. You?
Good. Are you a little bit shy sometimes talking to people you don't know?
Yeah.
I am too. Do you understand some questions if I ask you?
Yeah.
Do you know why I'm here today?
Yes.
Okay. Why?
John.
John? Who is John?
My boyfriend.
Is your boyfriend?
Yeah.
How do you know John is your boyfriend?
He kissed me.
He did?
Yes.
Where does he kiss you?
On my lip.
On your lip. Does he kiss you anywhere else?
Yeah.
Where?
Right there.
Okay.
John is the staff member that helps Diana with her daily routine. He's the only male staff member that she's comfortable with. Diana, you are doing great. Thank you so much.
Are you welcome?
Thank you, Dana, for answering that question.
Are you welcome?
Can I ask you some more questions?
Sure, yes.
I'm going to write them down. Is that okay?
Yeah.
Well, we roll up on this one, and we get there, and clearly we got an issue, right? All right. Now, this may be an internal police handle, but it may also end up being our handle. So, before we get into the jurisdictional issues, what do these officers do right?
They got a background on her, got a kind of a baseline as to what her level of functioning is, and her understanding and her ability to communicate. So they had an idea going in there what they were going to be faced with.
Anything else?
They took her someplace where she felt by herself, kind of private, and liked how they both sat down to her level, not standing up, kind of looking down at her, so she felt maybe more comfortable talking, so it didn't feel like, we're superior to her and she's in trouble, we're there to help her.
So some basic interview technique stuff that they did, right?
Correct.
Now, there were some other people in the room. Who else was in the room?
There was another female sitting on the couch that they never identified who she was.
Probably a staff member of some sort. Okay. Is that important to recognize what staff members or who else is present when you get there?
Absolutely.
Do we have to have some concerns? I mean, it's a staff member that is the potential suspect here, right? So in this, it was John, I believe. Do we need to take that into consideration when we're seeing who's in the room when we're conducting our investigation? What are the potential pitfalls? What are the issues?
Well, she might be a friend of John's. So the lady in the back might be, a good friend of John's. So you don't know what her relationship is to him or why she's even there. We don't know anything about this lady.
Right. Could intimidation be a factor? Right? We don't know the folks. They know each other. We don't know who they're comfortable with. There's any number of factors that could come in and actually kind of preclude that communications process. So when we talk about the communication, let's talk about the barriers. What barriers to the communication do we have with the victim?
Well, she's obviously Down's syndrome, and she can speak. She's just very slow. So, like open-ended questions, keep it simple. Don't use elaborate words or terminology.
Is the determination of the level of functioning important?
Yes.
Okay. In what way?
Ask her questions that you're going to get an answer to. You ask her if he orally copulated her. She's not going to understand what that means. Right. But when they said, "Did you kiss her? Or did he kiss you anywhere else?" She understands the word kiss. So keep it simple so that you can get, the elements of the crime that you need.
Does it change how we approach the investigation if the person is high functioning or low functioning? Does it change?
Just changes depending on how you interview the person. I mean, it may go back to something whether if the person's low functioning and you can't interview it and end up having to go to a professional to interview her. And then you end up getting just a corpus, initial elements of the crime from the staff member, and then forward that to a professional who would interview her then.
Right.
So
at what stage here do we incorporate the SART exam? Are we there or somewhere in this process?
We'd have to determine what the time frame was. When did the alleged, contact happen? Because the SART's only going to be valid for a few days. So
the standard investigative techniques, we need to understand when and where it happened, all of the elements of the crime, time, date, all the details, and then we move in that direction, right?
Yeah.
What's the difference now that we know that the potential suspect is a staff member? What challenges does that pose for us as the preliminary investigator? How about potential future victims?
Make sure that John isn't, still, dealing with patients, that he's, on some sort of admin leave, if not arrested potentially at that point.
Are we automatically to assume that the victim is telling the truth, that it's truthful or not? How does that impact how we approach our investigation?
You may speak with different staff members to find out if this guy, John, has a history of, flirting with, the patients there or behaving inappropriately or acting a certain way, or in return, like the patient, if she's loves to flirt with, staff members or likes to get attention, falls in love, those kind of things as well.
Definitely. What's her level of understanding? Does she fabricate things frequently? Is she a complainer and routinely states falsities? What's her normal MO, so to speak?
The history is important. The history is important. So we talked a little bit about the history of the victim. There's a history of the suspect. I think you mentioned that earlier. Anything else that we need to be taken into consideration, at least initially, when we get there?
Any potential witnesses? How long ago did this happen? Has it been going on for months, or is this an isolated incident?
What about crime scene? Important consideration, or maybe not so much?
Well, again, that's where you have to figure out when and where it happened. At some point, whether it happened in the facility there, in one of the restrooms, in her room,
Would the internal police department maybe be a resource to gather some of that information?
Sure.
Where else would we get some of that information?
Contact the head of security there and figure out, what areas are covered by cameras, and, what, if any, history do they have on, either of them.
Yeah. Is this something that we have to wait until we have an incident to do, or is there something we can do ahead of time if these facilities are in our jurisdiction?
If we're getting calls there all the time, I mean, it's good to go get to know, the people you're dealing with all the time in the facilities, and
well, it's probably good to make that relationship, establish that relationship ahead of time, just so we have some knowledge of the facility, what their protocols are, and things like that. As you saw in this scenario, they had a facilities police department, so it's important that we make sure we make that connection and get all the information that we can in order to conduct the most efficient, effective investigation that we can. There's a lot of resources through those folks that we need to include in this process. Agreed? Okay. So with that, let's go out and get it done. Be safe, and we'll see you at the end of the shift.
Barriers to an investigation. There are many in state hospitals and developmental centers. Starting off with, first and foremost, is the cognitive ability of the patient. Is the patient able to articulate in a coherent manner and give you information that could be usable in a court of law or as part of a criminal investigation? Do they have medication that they're on right now that could somehow minimize their ability to provide the required information?
What level of understanding does the patient have about what just happened, about their involvement in it, and what's their communication level or the ability to share what's happened, to share their experience with others?
There are real issues surrounding whether someone with a developmental disability or a mental health issue is going to be a good and credible witness. Unfortunately, too many investigators discount the testimony or the statement of the witness or victim too early on. That's a determination that needs to be made later by the prosecutor.
What they can expect or what they should anticipate that there may be additional challenges in interviewing and getting information that's needed to do a thorough investigation. There may be more difficulty in doing that than what they're used to.
When outside law enforcement is responding to one of our facilities for an investigation, it's very important that they not overlook the fact that a client or a patient has been deemed nonverbal. Nonverbal doesn't mean they lack communication skills. It means that they may have other preferred methods of communication, such as charts, pictures, sometimes eye movement, or sounds that they can utter, and individual staff who are familiar with providing day-to-day care for those folks can help to act as an interpreter during an interview with a client. So it's very important that they make every effort possible and ask those questions. If the person can't verbalize, are there other ways that they're able to communicate?
I have to understand that when I walk in there in a uniform, it's a very intimidating thing. We wear this uniform every day, so we don't think of ourselves as intimidating. But for a victim of a crime, a lot of times when they see the uniform, they think they've done something wrong.
It's definitely going to take longer, that you're going to have to be more patient, that you may have to be aware of what verbiage you use and what tone you use, even more in that setting than in an open community.
The main thing is, don't assume they can't understand you. Make sure that there's another way to work with them, to see if you can. And it might be that you need a staff person or somebody close by to help you with that.
You know, what they're comfortable with is always a good question to ask them. Even when you think, okay, this is a good room or a good position to interview somebody in, it gives them a little bit of control, and you may be wrong in your assessment. There may be something in there that is bothering them, and you didn't recognize that.
It's very important to understand that there's an element of unpredictability that will come with that interview. Clients and patients could assault or attack law enforcement officers during an investigation. They could become withdrawn and refuse to participate. They could become agitated or have other emotional outbursts. And sometimes facility staff need to assist in calming that individual down so they can get back to the interview.
If there are triggers that a person may have somebody may have had negative influences or negative experiences with law enforcement. They may not respond to you in a positive fashion, and instead of taking that personally or overreacting to something like that, you have to be able to pull back and take that into consideration, and then maybe withdraw. Ensure that you speak with them, don't speak at them or down to them. Treat them as a person, because they're just like you and me. And the unfortunate thing is that they've had to deal with their disability or their mental health issues.
Another barrier would be the staff that are actually at these facilities. There's a code of silence in some of these facilities. The code of silence being, if you tell on your coworker, you're considered a snitch, you're considered a rat, and you can be ostracized. And it puts people in a very, very difficult situation, because if they come forward and make an allegation against another staff person, depending who that is, the entire unit can turn against them.
Any investigation of an organization may come across peer pressure. That oftentimes leads people to participate or at least keep quiet about incidents that have happened and cover them up. We see that again and again in facility abuse cases where individuals that are employed there had nothing to do with the abuse itself, but feel pressured either from spoken pressure or unstated pressure to do nothing about it if nobody else is.
If you see a staff who's insistent upon being in an interview, then that could potentially be a red flag that they want to intimidate or know what that individual victim is telling law enforcement, whether that's to pass it on to other staff members who they may be protecting, or just so they can all get their stories straight, possibly. If somebody's covering up information, just be aware of anything that doesn't feel right, especially when the victim is uncomfortable.
Some of the questions I would want to know when responding to a facility are the basic investigative questions. When, where, who saw it, what happened, where's my evidence, where's my suspect, where's my victim, what's the condition of the victim. And then when I get the basics, it's a basic investigation. It doesn't really matter where it occurs, so you're going to want to know those kind of things. But in addition to that, you're going to want to know, why is this person in this facility? Do they have a violent past? What's their functioning level? Who deals with them on a daily basis that can tell you this is the standard behavior for this person, this is something unusual? What's the best way to communicate with them? But, in reality, it's an investigation.
How will your investigation techniques differ when in an institutional setting? Should you handle your investigation the same, whether within a facility or not? Since the suspect, victim, and witnesses are committed to the facility, there is a lot of information you can obtain from internal law enforcement and staff. Take advantage of what they can tell you about the alleged crime, suspect, and victim.
For SAM 10, patient-on-patient assault, Metro Regional Mental Health, 1600 Birch Avenue, East Entrance Gate. Suspect has been secured. No known weapons. RP will meet you at the entrance by the security gate.
Whoa, wait. Okay, don't touch anything, don't move anything here. The police will have to see this as it is. I'm gonna go check on Robbie, okay?
Hey, the officers are here to see you.
How you doing? Officer Delgado, my partner.
How you doing? Brad, nice to meet you.
You called for us?
Yes, we had an incident between two patients earlier today in our dining facility.
Okay, what happened?
Apparently, one of the patients took his tray and proceeded to beat another patient around the face with it.
Okay. Did the victim get hurt?
Yeah, it was pretty severe. The wounds around the face. He's being treated right now in the clinic.
Okay, and what's that aggressor's name?
The aggressor is Mark Rios.
Okay, and your victim?
Robbie Bend. He has a history of stealing food from People's Grace.
Okay, and your aggressor, where is he at?
He's being held. He's slightly sedated. He's in 5-point restraints.
Okay. Where did this happen? Where did this actually happen at?
This was in the dining facility earlier today. Facility police have closed the area off.
Okay, so the crime scene is secure?
Yes, that's
okay,
correct.
Great. And right now, where is the victim?
He's being treated and awaiting personnel to take him to the hospital.
Do you mind taking us where he's at right now?
Yes. Thank you.
How you doing today, sir?
Okay.
What's your name?
Robbie.
Okay. Robbie, I was told that you were involved in an incident today.
I got beat up.
Okay. What time did this happen?
I don't wear a watch. It was after lunch.
Do you know what day it is today?
Tuesday.
Okay. So what exactly happened?
I was in the dining room and took a French fry off this guy's tray. He's a crazy guy, and he just starts wailing on me with his tray.
Okay. About how many times did he hit you?
More than 5.
Okay. Do you mind if I see your injury here? Yeah, okay, that's not so good. Anything else that you want to add?
No, the guy's crazy.
Okay, all right. I'm going to step out. I'm going to come back and talk to you and take some photos of your injury, okay?
Yeah.
You hang in there. You'll be okay, all right?
Yeah.
All right. So what do we have here?
Assault.
Battery?
Yeah. 245 potentially.
All right. Any special circumstances? Anything we need to be worried about?
Probably, why are they both there? I mean, should they have been at lunch at the same time, you know? A little bit of history on both of them to find out, you know, if they're supposed to be together, or if, you know, we know that there's a history of one of them stealing food. Do we have a history of the other one being violent with other patients?
What about protocols for us upon our response when we get there? Things we need to take into consideration?
Contact their security and its jurisdictional issues. You know, if it's something that we're going to take or they're going to take.
Okay. What might determine whether or not it's our jurisdiction?
Whatever protocols or, you know, MOUs you have established with the facility.
Okay, MOU is one piece. Does the significance of the crime have impact on that? Whether it's assault with a deadly weapon versus a simple battery, does that have any impact on who's going to take it? How about history? History of the suspect and the victim important?
Oh, yeah.
Yeah? Why, do you think?
Maybe they've been in previous altercations. You want to find out something been going on in the past between both of them. If they have previous history among other inmates as well.
If you caught in the video where he talked about that,
he's a chronic,
he said,
steals food.
Yeah, he steals food from people's trays. Well, in this case, the guy admitted to, I took a French fry off the guy's tray. So those might be some significant investigative leads and might dictate the direction in which we're going to go. Yeah. What about with the victim or the supposed victim? Is there potential that he could be a suspect?
Potentially, he probably instigated it, but he got the worst end of it. So,
in the video, it talked about some sedation and some restraints that were put on. Does that impact how we move forward with our interview or in potential interrogation?
Yeah.
In what way?
Well, he's been sedated, so he's not going to be able to give a complete and accurate statement.
Should we then not get the statement, or should we get the statement and follow up on it?
It depends on how sedated he is. You can try to get a cursory statement, but it's, you know, questionably whether it's going to be admissible.
Right. We agree?
Mm-hmm.
Yes. Okay. We should interview and interrogate there and get as much information that we can and then move forward. And if we have to come back and do a re-interview, that's what we do. Right? In the video, it talked about them being in 5-point restraints. If the person was in handcuffs, does that change how we approach the interview?
I consider that only for our safety.
Okay. Are there any legal issues, Miranda, or any of those kind of issues when we go to approach them?
I mean, not if you're not arrested. You're just getting a statement.
Just getting a statement from him?
Mm-hmm.
Okay. That might be a concern of some folks in the investigation if he's already in a custodial environment, so to speak. He's not free to leave.
Yeah.
So we do need to kind of take into consideration what that is and maybe check with the local DA and how they want us to move forward. But those are certainly some concerns we need to make sure we take into consideration.
Well, that may be something also you just may tell the suspect, you're not under arrest, you're just being detained right now. Do you understand? It may be different in this situation just because he's sedated, but you may still want to verbalize that just so that there is no gray area, you know, so that person understands in his mind that you're letting him know outright that he's just being detained at the moment and he's not under arrest.
Well, I think it's safe to say that in these facilities, it brings with it some challenges that we don't normally have outside when we contact folks. So let's just be aware of the circumstances and make sure we adjust accordingly when we're approaching it for our interviews. When you go to these facilities, should we expect the crime scene or the scene to be pristine?
No.
Right. Probably very similar to the way that we respond to any other type of crime scene. It's going to be contingent upon a whole lot of factors. In this particular environment, what are some of those factors?
Whatever their protocols might be, already established. That's inside a state hospital. So, like I said, the janitor appeared like he was going to come in and clean it up because that's what his goal was, is to clean up the mess. And then the other guy comes in and says, oh, wait, let the police handle it. So it's just a question of who's in charge, and who gets there first.
What about baseline behavior? Do we need to identify any of that, the baseline behavior of the suspect or the victim?
It's important to know and talk to the staff members to find out what their baseline behavior is. If they're, if there's constant issue with violence with one or both, or if it's a first-time incident that happened.
Is why they're in the facility something maybe important? Maybe getting to the records and identifying what the history of both?
History is important to understand why they got there, history outside the facility as well. Could be a situation where these gentlemen could be roommates, as an example. That could be a factor, or not. Or if they only meet during that time for lunch or dinner, whatever that situation is. So,
well, we touched base on a lot of things that came out of the video. I want to make sure you guys keep those things in mind when you're out here and may potentially respond to one of these facilities. Also, we need to make sure that we understand and recognize that these are patients. Some have some mental health challenges and they're there for treatment, and we need to approach our investigation with that in mind, okay? You good?
Yep.
All right, guys, let's hit it. Let's get out there and take care of business.
When external law enforcement has been called to either a state hospital facility or a developmental center facility, it's very important for them to first liaison with the facility law enforcement officers. Find out what type of incident they're responding to, what's already been done. Has the crime scene been locked down? Has any evidence processing been started? Have any interviews been done? Any written statements taken from any of the staff or witnesses present at the scene? And then find out more about who's on shift, what's going on with our victim. Do we know about their level of functioning, any medications? Have any of the involved parties been placed in restraints or received any type of medication to assist in calming them down? Have people been transported to the local hospital as a result of injuries that may have been sustained? Has someone been sent out for a SART exam already in the case of a sexual assault?
The hospital staff are fantastic resources to give police officers information about the current functioning level of patient and any information that's relevant to the investigation pertaining to the patient's treatment. What they need to know is, can this person understand my questions? Can this person adequately answer questions so that I can get the data I need to finish the report? Are there any concerns about physical safety that they need to know about, such as does this person have a history of physical aggression and under what circumstances?
Are they in restraints? Have they been chemically sedated? Are they able to provide statements that aren't being viewed as being coerced?
The medications do have side effects, and sometimes those side effects can be things like causing a patient to be sedated. Occasionally those medications can cause people to maybe be a little confused or may make it difficult for somebody to process something at a normal speed.
Whether a suspect is sedated or not, I think it's important to still try to obtain a statement from that subject. You can always go back later and attempt it again. A statement is better than no statement.
The physical condition of any suspect being interviewed can weigh and impact greatly any case from investigation to prosecution and into court. For law enforcement, it's best to view that they're already in a custodial situation. If they're also restrained, handcuffs, tied down to a bed, or 5-point restraints as it's referred to, that's one more indicator that law enforcement needs to proceed with caution, but they still need to proceed. Some courts have taken the view that they're not free to leave at all. So the better part of policy is to Mirandize every suspect at the facility as if they were not free to leave. If law enforcement does not Mirandize the suspected individual, it may be a problem that cannot be overcome later by the prosecution in court.
There is a challenge dealing with crime scenes in a state hospital or developmental center, in that a lot of the staff members are there and their main concern is biohazard issues. So if there's an incident of an assault with a deadly weapon and there's blood on the floor, or there's weapons with blood on them, staff may not be fully trained and aware that their first instinct is to clean up the biohazard, and they're not aware that it's a crime scene, that everything should be kept untouched and non-contaminated until law enforcement can arrive and respond and collect whatever evidence they need.
The forensic evidence that can be available from a crime scene can make or break a case. But too often law enforcement is bullied by medical staff or at facilities into not fully collecting forensic evidence. Any good crime scene investigation includes photographs of where the crime occurred, what the room is like, what the facility is like, what the conditions are that are present at the time of the crime. And if the facility raises objections to it, then get everyone else out of the photo and take a picture of the scene, not the individuals at the scene that are unrelated to the crime itself.
So if you have a significant event where outside law enforcement is going to come and investigate the incident, you want to make sure that the local hospital police officers secure the medical file, the medical chart, allow the doctor, the nurses, the level of care staff to continue making medical notes, but you have to secure the file, because if there's something that wasn't done or something that was done that could potentially have contributed to whatever has occurred in a particular event, you don't want somebody going in there and removing data, adding data, or manipulating data. So you have to take it away and treat it as evidence.
There are challenges when dealing with a patient's medical chart. Law enforcement can secure a patient's file and treat it as evidence, but cannot have direct access into it.
HIPAA is an interesting challenge because HIPAA was designed largely to protect the personal health information of patients. Where it gets a little tricky is when someone who comes into the setting, say the hospital, and wants information about a patient, and they aren't part of that patient's treatment team. So they're outside the bounds of that law. That's where law enforcement falls. So we have to be cautious because we don't need to give them specific patient information, but telling an officer a patient's capacity to understand questions, telling an officer the patient's personal limitations. For instance, they don't feel as comfortable speaking to men as they do women. Telling the officer a bit about the patient's background in general that would not only help the officer proceed, but also keep the officer safe, such as this person has a history of physical violence toward men or in a particular situation, these things are not violations of HIPAA.
There are guidelines in place to make sure, depending on the severity of the crime, that it is reported in a timely manner by the facility staff. Should a staff member fail to report within the mandated time, they may opt not to report at all or not cooperate during an interview for fear of being reprimanded. Welfare and Institutions Code 15630 mandates that facility law enforcement and any institutional staff report a suspected crime or abuse. They must report within 2 hours from when they became aware of the crime. We've discussed how to overcome barriers and how to conduct an investigation within a facility. Coming up in the next section, we will look at how to approach a patient who is agitated or could become violent. This includes suggested language and some de-escalation techniques.
A challenge is to recognize that even if a patient suffers from a mental disorder that includes delusions, that doesn't mean that a crime didn't occur. Sometimes even our delusional patients are telling us the truth. With mental health patients, it is not uncommon. It happens so frequently that we'll de-escalate a situation and then they'll re-escalate in an instant. These people are very unpredictable. And even after a positive interaction where they de-escalate them and it appears as though they're cooperative and calm, that could backfire.
Officer safety should always remain your number one priority. Once that is taken care of, here are some techniques that may be helpful when questioning patients within mental health facilities, developmental centers, and group homes throughout the community.
3 Charles 11, possible prior theft from a residence, 207 North Shasta Lane. RP refused to provide further information but requested contact.
Hello. Can I help you, officers?
Hi, we're responding for a theft report. Do you know anything about what's going on today?
No, I'm Tom Linderman. I'm the residential staff for the group home here. And I think the call may have been from Paul. He's been agitated a little bit more than usual today, so that's probably it. He's in his room if you need to speak with him.
I see. Do you have any background on Paul? Do you know why he'd be calling the police today?
Well, Paul's been diagnosed with bipolar disorder. It just means that, I think what happened is he's off his meds today, and that's happened before, where he'll go off his meds and he will get these experiences of mania or has delusional thoughts. So I think that's probably what happened.
Okay, is Paul the only one inside today?
No, there's Paul and his roommate is there as well.
Okay, and are they both in his room?
Yes, they're both there.
Are there any safety issues or concerns inside his room that we should be worried about?
No, they're fine. You're welcome to come in.
Okay, thank you.
Sure.
Thanks.
Paul, some officers are here to see you.
Come in.
Call 911.
I called over 2 hours ago. Finally, you got here.
I'm sorry it took us so long, but we're here to help you now.
I've been robbed.
Okay.
This place isn't good. It isn't right. They stole my money.
Okay,
I think that they should be arrested, and I think I know who it is. I think it's the main man. Yes, it's the main man. They took my money, and stealing is a crime.
Okay, and I'm really sorry this is happening to you, and we're here to help you.
Well, okay. They have all my money, okay? And I used to get $35 a week, and now I get $25 a week. And they think that I don't want that they're stealing, but they are stealing, and I can tell that they're stealing, okay?
Okay.
And now $10 is a lot of money, and I want them to be arrested because it's my money, all right? And stealing is a crime, and it is mine. Yes.
Okay, and I'm sorry this happened to you. Do you want to talk in private, maybe away from your roommate?
Can you help me get my money?
We'll talk about it.
Okay, because they've been taking it for months now. Because it's my $10, and they shouldn't be stealing from me.
Okay, Paul, have a seat. So can you tell us what's going on?
I'm being ripped off by bin Laden, a little bit at a time. He thinks that I don't know, but I do. He's been stealing $10 from me every month now.
But why would Osama want to steal from you?
Well, you see, I'm with the CIA, and bin Laden, he gives me my allowance, and lately it hasn't been the full amount. It's been less and less.
I see. Well, I'm sorry this is happening to you, and I really appreciate you telling us about this. So we're going to try and do an investigation.
Good. Are you going to arrest him?
Well, Paul, just so you know, we can't just go out and arrest someone without conducting a proper investigation, but we will look into it and see if we can find out what's happening to your money, okay, Paul?
Okay, good, thanks.
Thank you again for being so calm, okay? Thank you for talking with us today.
Thank you for coming.
Sure.
All right, Paul, take care, okay?
Bye.
Bye-bye.
Bye. Thank you.
Oh, so is everything okay, officers? Paul seems to have calmed down.
Yeah, Paul thinks that his money's being stolen. Is there any way you can help us with our investigation? Maybe records, financial records that go back a couple months?
Yeah, I could do that for you. I'll go get them.
Thank you.
Yeah.
So in this video, what did the officers do right?
First thing is they ask about safety before they came in. Are there any safety concerns? before they came into the residence if there was anybody else in the house that they needed to be concerned about prior to contacting the reporting party, asking about any history, basically, you know, why would he be calling, you know, so they got a little bit of a background, the fact that he has mental issues and he's been acting up earlier today. So that I think that was a good start to them contacting the reporting party.
What's different in this particular tape that might not be the same as what we've seen in other tapes? Do we see any differences here?
This is a residential facility, not a state or county run facility.
Is there some significance to that for us as investigators?
It's less secure.
Yeah, it's less secure.
Some security issues, right? Let's talk about that a little bit. What kind of security issues are present here that are different than maybe some of the other responses we might encounter?
They could have access to possible weapons. I mean, maybe things in the kitchen could even be a weapon, or things that they could have in the rooms. Just different than, it's not as secure as in a facility.
Kind of intensifies the response a little bit, more along the lines of what we're used to outside of an enclosed, secure facility. Right. Any other issues that you saw with the officers going into the residence? Anything good or bad?
Well, they never did a pat down on him. They should have patted him down at least, you know, because he is very animated. He's sitting there tearing apart a newspaper or magazine. He's frustrated. He's paranoid, you know, potentially delusional with Osama statements and stuff. So it would have been nice just to, you know, maybe do a cursory pat down on him, you know, before they sat him down on the chair. You know, let him know that he's, you know, not under arrest. This is for my safety, your safety. I'm just going to check you real quick, and then we'll carry on our conversation.
Yeah, I agree wholeheartedly with that, making sure that it's safe to continue with the investigation. But you brought up a good point. You're talking about the delusional aspect of the person we're talking to. Does that impact whether or not a crime has occurred, in your mind?
Potentially.
In what way?
Well, because if he believes Osama's, you know, stealing money from him, he's delusional in that respect that it's Osama as a suspect. But then again, he may be actually a victim of some sort of embezzlement, but it's just, you know, his idea of who the suspect is his delusion versus it could be a staff member or another client there, you know, is actually stealing from him. So he may be a victim, but it's just he doesn't realize who the suspect is.
The facts may be that there is a crime that has taken place, sure, right? And so how do we approach it, knowing all these factors? That we have a potentially delusional person, and we have a potential crime here in a house where it appeared that even the caretaker was unaware that the police were going to be called out. How do we deal with that?
Basically the same way the officers did in the scenario. They established, you know, what his baseline is. The manager there said that he's off his medication. You know, what medication is he supposed to be on? You know, how long has he been off his medication? You know, when has he, you know, been seen by a doctor last? Does he have a payee that handles his finances? You know, that kind of stuff, because these facilities are usually voluntary facilities. They aren't locked facilities like in the previous scenarios. So the patients usually can come and go at will and are there because, you know, they pay to be there, or the state pays for them to be there.
Yeah, absolutely. There might have also, in that video, been some nuances that we need to make sure we consider. If you noticed in the video, the victim, he kind of yells over the officers and says that it's a crime. He yells that out. So is it possible, when you're conducting your interview, that maybe he's made this report before and people don't believe him?
Probably.
Does that impact your investigation?
I think the officers did the right thing in going back to the staff member to find out, you know, can you help us? Can you give me some financial, you know, records of, you know, how much he's getting paid? Is there any change in his accounts? The only thing that I saw with the officers is I would have separated him from his roommate initially instead of letting him get excited in front of the other roommate. It seemed like it would agitate the other roommate that was there. So I would have taken him out of the room pretty much close to contacting him, getting him out of the room, you know, patting him down, then getting him to another area where it's, you know, separated from the roommate, where it's not agitating the roommate, because we don't even know if the roommate may be involved somehow.
Kind of reduce the potential for some safety issues. But also, if the roommate's involved, he's now privy to any conversation we're having with the potential victim, yes?
Right.
So we need to be applying some pretty effective investigative techniques to get to the bottom of it. And it looks like the officers were starting that out pretty well. They were going to go to the caretaker to see if they could get the information. They were very, very calm and cool. And let's talk about that for a minute. Did you guys notice the de-escalation in the officers' demeanor? Were they effective in your mind?
I think they were effective because they empathized, you know, and they were encouraging the victim to talk, you know, thank you for sharing that with me, thank you for talking with me, you know. You could see the empathy right off the bat from the contact officer. When she was talking to him, she maintained calm, And then they did take him away from the roommate into another room where to separate, the anxiety that was going on in that room between the two roommates. So I think they did a good job of handling that.
And some of the basic interview stuff is where they sat down, got to the same level, and they tried to calm him down and talk to him and figure out what was what. So I think they were pretty effective in what they did. Were there any other issues that you noticed in there that are applicable here?
I thought personally they could have, potentially once they were done with their investigation, reference the loss of money, they could have evaluated him for possibly a 5150. Talked to him. He's obviously agitated. He's delusional, very animated. Could have asked him certain questions about, are you upset enough? Does this bother you enough to where you might want to hurt yourself? Or hurt any of your roommates or hurt anybody else? I know you're upset and we're doing what we can to help you. But if we can't resolve this today, are you going to be okay? Are you going to do anything extreme? And if possible, if he meets the criteria, then you can get him to the hospital and, help with some of his mania that he's going through right now.
I absolutely agree that we have some kind of responsibility to make sure that there's not going to be a future problem down the road.
Mm-hmm.
Maybe identifying whether this is baseline behavior.
Yeah.
The caretaker said that he may be off his meds, so that's a significant consideration as to how we move forward in our investigation. You agree?
Mm-hmm.
Okay. Anything else, guys? Any questions? I think they performed pretty well. I'd like to see you guys do the same. So make sure when we get out there, we're taking care of business. There's 5 of these locations in our jurisdiction, so be aware of them. Maybe even get by there before a call comes. Get familiar with the lay of the land, get familiar with the staff members, and let's stay up to speed on what we got going on, and let's hit the street, get it done.
The scenario we had where the guy believed that Osama bin Laden was stealing his money. Well, he might actually be a victim of theft. However, clearly Osama bin Laden's not stealing the money, but it doesn't mean that his money's not being stolen.
Anytime that law enforcement responds to a potential allegation of abuse or a crime committed against an individual, it's imperative that law enforcement officers respond to each allegation and assume that the allegation occurred as reported.
Just because they live in a group home doesn't mean that they're just making it up, that they're trying to get somebody in trouble. That is a possibility. But I would investigate vigorously.
It's important to keep in mind that not everything is going to amount to criminal charges. But the process is in place, so when there are allegations of abuse occurring, they're reported properly and timely, they're investigated fully, then they're reviewed by prosecution to see if offenses actually occur and there's actually enough evidence that is admissible to prove to a jury beyond a reasonable doubt that this crime occurred.
Understanding that the person's under a lot of stress and they called for help, and so they're already in a crisis mode, so it's really important to be able to calm them down and not create additional stress for them. So a lot of the different ways that we do this is explain why we're there, that they're not in trouble, and use a very soothing voice when you're talking to them, and also announce what you're going to do before you do it and explain why. Like, for example, I'm going to get on the radio right now and I'm going to call for an ambulance to come help you because it sounds like you're injured and you need help, rather than just grabbing the radio and start talking because they don't know what you're talking about.
So as an investigator or law enforcement officer, when you approach a patient as part of your interview or interrogation process, and they could be highly agitated, you don't want to come in there with a style that could potentially amp them up or continue the aggravation. You want to come in calm, cool, and collected. Just have a calm demeanor. Just bring them down as much as possible.
Keep it short. Keep it simple. Tell the person what you want them to do, not what they're doing wrong. Don't focus on what they're doing wrong. Tell them what you want to do at that point in time.
This might get a little more tricky, but sometimes eye contact is really good. Other times direct eye contact can be very distressing for people.
Identifying a basic need that they need to sit down. Do they need something to drink? Is there something that I can do right now? Is there something that I can do right now to make you feel more comfortable? Well, yeah, you're too close to me. Okay, so if I step back a few feet, will that make you feel more comfortable? Yes. So asking them what you can do to make them feel more comfortable, again, empowers them.
There's a tendency sometimes to treat them like children. And I think for a lot of our folks, they would find that undignified. Most of them would feel that you're treating me like a child, and I'm not a child.
So what happens if your interview is going well, but the suspect or victim's demeanor unexpectedly changes and escalates?
Some techniques that work well to de-escalate agitated patients include keeping a safe distance, but not too great a distance that it creates psychological distance for the patient, but always keeping your voice calm and steady, paying attention to the patient, looking at them, nodding your head in agreement or in understanding, even communicating things that sound validating like, I hear you, I understand what you're saying, I don't blame you for feeling that way, I completely understand. If I were in your position, I probably would feel similarly. Those types of comments really go a long way in de-escalating patients.
We are the authority. We come in with that uniform, we already are the authority, but by giving some authority to the person asking if it's okay if I talk to you, is it okay if I sit down, that has a disarming, because all of a sudden, yes, I'm making a decision, I want you to sit down and talk to me.
Speak with the individual, don't speak at them. Speak at their level, and you'll have lower functioning clients and you'll have higher functioning clients, so just speak at their level.
Just because you've had repeat calls at that location, you still have a responsibility to assess if a crime has occurred. And people with these conditions, I think they're more susceptible to being victimized because people won't believe them. And so the officers have a responsibility to do a thorough investigation on the incident that they're investigating at that moment.
One of the big problems in investigating and prosecuting crimes that occur in facilities is that too often they're discounted, both by law enforcement and by prosecution. The idea that it's not so bad, we can't really prove it, the victim doesn't make a good witness, we don't know what really happened. But it's important to keep in mind that every case needs to be investigated. And the unfortunate downside of it is, if they're not fully investigated, if we don't look into what really happened, if we don't prosecute fully, we may be leaving the door open for that abuser to further abuse that victim and maybe abuse them even more severely the next time while we sat on our hands. And nobody wants that to happen.
We hope that this training video has given you some insight on how to better conduct investigations within mental health facilities, developmental centers, and group homes. I'm Mark Bailey, and on behalf of the Commission on Peace Officer Standards and Training, we would like to thank you for watching this program. I encourage you now to take a moment to listen to some final thoughts from our subject matter experts. This course is designed to be facilitated in a group setting. Before conducting a group training session, you should review and become familiar with the material in this program. Open and print the facilitator guide and go through the program yourself before putting the course on for others. As the facilitator, your job is to engage your students in constructive, free-flowing discussion on the key learning points of this training topic. Use the tools provided in this program to stimulate critical thinking and situational awareness in the group by viewing the scenarios, expert interviews, and discussion videos. Questions and activities are provided to promote group interaction and discussion on the training topic. Customize the learning experience by applying your agency policy and procedures to the training concepts. Segments in this program accommodate shorter training periods, such as during roll call training sessions. Track your students' progress through the entire program. As the facilitator, you need to know that your students have gone through the material and sufficiently mastered the learning objectives. Once the students have successfully completed the program, submit your training roster to POST for CPT credit. Following this plan will help to create an environment for the debate of ideas, sharing of wisdom based on experience, and encourage a greater understanding of local policies and procedures. We wish you and your agency all the best in successfully implementing this program. This course is designed to be facilitated in a group setting. However, when that is not possible, here are some instructions for getting the most out of this training program so that you may receive continuing professional training or CPT credit. Obtain permission from your agency trainer or supervisor to view the course for training credit, and let them know you will be viewing the program. This will give them some time to review the course themselves and be prepared to discuss it with you later on. Open and print the student study guide so that you can take notes and fill out responses to the questions and activities. Think about how the training concepts presented apply to your agency policy and procedures. You may view the scenarios, expert interviews, and discussion videos several times to assist you in providing responses. Keep track of your progress as you complete the segments in this course. When you have finished the entire program, inform the trainer that you would like to review the course with them. Send them your completed student study guide prior to meetings so that they have had a chance to review your responses. Scheduling a face-to-face meeting with your trainer is the best way to review your work on the course. If this is not possible, arrange a phone call meeting. But in either case, allow time to review and discuss your responses. Your supervisor or trainer may require additional work or feedback from you before giving CPT credit. They may want to evaluate your understanding of how the training points relate to your agency policy, for instance. It is their discretion in determining whether you have adequately completed the course. Following these instructions will give you the best opportunity not only to receive CPT credit, but to grasp the training concepts, benefit from the experience of others, and apply the training and experience to your local policy and procedures. We wish you and your agency all the best in successfully completing this course.
I think one of the things is when you're working with this population, you understand right away that you're working with a fellow human being who is more like you than not. They have a lot of the same feelings. They might not present it the same way as you and I would do so, but they have these same feelings. They have a lot of the same needs. The need to be comfortable, the need to have something important in their life, the need to have relationships with other people. A lot of these folks have had a rough life.
If you have state hospitals in your jurisdiction and you know you're going to be responding there, it's best to really have an idea of who your players are, who your charge nurses are, who works the weekends, who works the evening. Is there somebody you can get a hold of 24/7? I believe that the more information that you get before you have the crisis, the better you're going to be able to respond to the crisis.
It's imperative that we respond to them in a compassionate and empathetic way and do as thorough an investigation as possible because they need protection.
If they're in crisis and they're acting out and they're calling names and they're engaging in behaviors that are very disturbing, there's a deep need that's at the base of that.
Ultimately, the goal of the facility police force, as well as the staff and as well as local law enforcement, is to provide a safe and secure environment for these clients, for these patients, to ensure that they are not being abused or being taken advantage of or neglected.
I think officers that are watching this training video, one of the things that they should really keep in mind is that these are patients that have mental disorders. They don't perceive the world necessarily the same way that you do. Things that might seem innocent or normal to you may seem very threatening to a psychotic individual. These people are not always going to react in the ways that other people would react. It's important to keep in mind that they view the world differently.
I think what I would like officers to take from this video, if it's just one thing, and that's that they're in a position of public trust and to provide their services, utilize their training and experience to conduct investigations as they would with anyone, as if it was a family member. Dealing with persons with developmental disabilities or mental health issues may be a challenge because of the methods you have to utilize when you make your approach to the investigation, but the techniques are the same, is to conduct a thorough investigation.
I'm glad that these training videos are going out to police officers at large because they're going to be coming more often. They're required to show up now and intervene more directly than they ever have. So it's really important that they understand what life is like inside these institutions and what life is like for our patients and what types of behaviors they can likely encounter. And the more they are up to speed on those issues, the better job they're going to be able to do and the better our patients will be served.
And we have to keep in mind that these investigations and prosecutions are there to help protect some of the very most vulnerable members of our society, those that can't even really care for themselves. That's why they're in the facility. We owe them our best work to protect them and bring them justice.